Hello, I'm Dr. Jim Coyle, and this tutorial in social work practice with families focuses on another two models of classic family therapy, the experiential model, and I'm going to talk about Virginia Satir's use of the experiential model, since her perspective as a female social worker was really unique in terms of that early development of family therapy. I will also talk about the strategic model and focus on Jay Haley's use of the strategic model. As I've mentioned in the past, it's important to read about the models in the textbook in order to identify the primary concepts, since I'll just be reviewing those concepts. It's also important to recognize that this is an introduction to these models rather than a training on how you would expertly use these models when you're working with clients. So jot down what you've learned from the textbook and from other sources about using experiential family therapy and how it fits with other models that perhaps you've learned about in the past. In experiential family therapy, Virginia Satir really defined emotional expression as key, which in some ways is very different than Murray Bowen's approach that we talked about in the previous tutorial. Communication is both instrumental in that it gives a request or information, as well as expressive, expressing our feelings and needs, and functions best when these two elements work together and agree. Communication should honestly and openly express what the person perceives, acknowledge individual differences and uniqueness, and in the family, communication is used to negotiate family decisions democratically, which means that everybody is involved and their needs are heard rather than they bring it up to a vote. In Satir, assessment and intervention occur simultaneously. They are not distinct elements because they focus on family communication. So as the family is talking about the presenting problem, she may be encouraging the family to talk to one another and focusing on how they can do that better, even though the presenting problem may be the content that they're using. Her therapeutic sort of focuses on how they are talking with one another. She encourages them to evoke emotional expression by asking, how are you feeling? Tell your family member about this. She highlights positive connotation and warmth. She was a very warm, empathic person herself. And so the worker in an experiential therapy is very much involved in warmly talking and complimenting families and telling them what they're doing well. Satir also tended to use touch a lot when she was working with clients, which can be problematic today due to different kind of our present connotations about how touch can be problematic in boundaries. She tended to act as a coach in family conversations, often having families divide into subsystems so that she could easily coach them into talking, perhaps two people at a time, back and forth about what they're looking for, how they're feeling, and really trying to understand one another. She also used a technique called family sculpture, in which she encouraged one member of the family to pose other members and depicting a family issue so that they would show how that they perceived what was going on rather than talk about it. For example, a child may pose father as kind of standing over the family while mother was looking the other way or doing something different. And that would, kind of signify how the child saw what was going on. And then they may turn and say, okay, now, mom, how do you, do the family sculpture over again to show how you see things, which is a little bit different. And that helps the family communicate in a very physical way about differences that they see. And the Greene family, what we want to do is look at the feelings and communication that they are displaying. So the worker may begin by talking about how well the family members express their feelings. So, mom is obviously expressing her feelings. Alice is saying, I feel everything's going to be fine, but that expresses how she sees things. And even dad, although he's saying, I'm not going to say anything, expresses that. So you can start off by talking about how each of them clearly is expressing what was on their mind and expressing feelings, perhaps. But the worker will also talk about where communication does not occur. So it may be that mother is having a difficult time because her daughter is not answering her questions. Or father is saying, I'm staying out of this. And that means that we're not getting a sense of what he may think or may go on there. And so family counseling using Satir's experiential model would first show that the worker shows interest and compliments and encourages, but then the worker asks the family to have conversations and coaches open communication of feelings. And so there may be ways that that the worker can encourage them to talk a little bit differently about the fact that they're not talking about this. The worker tends to also encourage decision-making by all family members, although this may be a challenge with the way that the Greene family has set up their decision-making process. So in the in-class role play, when I use experiential family therapy with the Greene family, I'll try and demonstrate this and see what happens when I suggest ways that they can talk to one another about how they feel. Some suggestions for how I could go about doing this are that, well, before we get to that, this slide talks about the goal is to have everybody communicating with one another and with the therapist guidance that enhances their feeling expression. And this slide asks you to take a look at how you might use this with with families that you're working with in your own workplace, and what you would say to them about honest, open communication and family conversations and sculpting, and how would you begin to do a process in which assessment and intervention seem to be intertwined. And jot down your notes about this so that we can talk about them in class. One of the things that, before I get to Jay Haley, I just wanted to talk about what I didn't put down, obviously, and that is that with the Greene family and experiential therapy, we may be asking for mom to be able to communicate her feelings as opposed to the information that she wants, and for her daughter to communicate how she feels about being an adult and kind of making her own decisions without mom telling her what to do, as well as dad perhaps communicating his feelings about being left out. And that may be a way of proceeding. Now, to move to another model. Strategic family therapy, one of the developers was Jay Haley, and it's helpful to look at what he recommended and how he discussed things. Certainly earlier we talked about how he talked about the first interview and the goals that he wanted families to do in order to identify what was happening. It's important for us to recognize that strategic family therapy feels that people are always communicating, even if they're not saying anything. The communication has a report that is giving information as well as a command, and that is a request function. It's circular. It's influenced by feedback loops to maintain family homeostasis. And notice that strategic family therapy uses a lot of systems theory concepts, and that what the worker is looking at is identifying how communication patterns in the family kind of really come together to maintain homeostasis, but also to maintain whatever the presenting problem is. There's a focus on first order change using the family's current rules and ways of working things out. And is that sufficient? Or is there a need for second order change in which new skills or new rules are needed? At the time that Jay Haley was developing this model, and the third order change, which is how the environment may influence, was not really something that was considered. That came later. In strategic family therapy, problems develop due to ineffective feedback loops that come from cybernetics, or a poor family hierarchy, a difficulty with family hierarchy, and which is similar to what structural family therapy talks about, as well as considering how family functioning maintains the problem, how the family communication patterns kind of not only cause the problem, but maintain it, make it difficult to change it. And this is a functional analysis, which is based upon behavioral theory. An assessment, strategic family therapy asks the family to describe the problem, what they see and what they hear. They often ask the family to talk with each other about that problem, similar to the enactment used in structural family therapy, so that the worker can begin to identify the communication patterns that maintain the problem. Although this is not usually shared with the client in this model, because there's a question about reducing resistance of families feeling that they're being judged by the therapist. The client-worker relationship is key. And in strategic family therapy, it is up to the worker to show the family that the worker is listening, that they're understanding, that they are paying attention to what is going on, and that they are describing what they are seeing and how the communication patterns are actually kind of taking place, and how this represents rather than really causes the presenting problem. Change is often done by either changing the way people think, which is an element of reframing, or how they do the presenting problem, which is done through the use of directives. So, for example, in reframing, if we have a problem where parents are complaining that Bobby is coming home from school and refusing to follow mother's rules and getting in big arguments with mother, and she says, wait till your father gets home. It may be that the family is really presenting Bobby as a problem child, that Bobby's a bad boy, and that this often results in a poor way of changing the communication. So a reframing of that situation may be that the worker suggests that, well, perhaps Bobby's behavior is very problematic, but it seems like what Bobby is able to do is get parents to talk with one another about him and to give him his attention as a result of that. And that begins to change the way that the family views the problem and how they may then consider doing something about the problem, which are the directives. Now, there's any number of types of directives, but three that are particularly used in strategic family therapy are tasks, rituals, and ordeals. So in this particular situation, a task may be to ask the parents to talk with one another about identifying what behavior they want to see from Bobby after school and what the consequences will be if he does not do that behavior. And then they can share that with Bobby. And so that can be a general task of how they will come together and kind of begin to change the, mother saying, well, wait till your father gets home. On the other hand, a ritual could be that, 10 minutes at the end of dinner, they will all talk about what Bobby's behavior has been and where he has been doing okay and where he needs to improve, and that becomes a pretty standard thing in the family after that dinner. An ordeal could be that they give Bobby timeouts for misbehaving, and they have to spend that time out with Bobby in order to make sure that he understands the significance of this and the seriousness of this, and that everybody's taking a time out. So that links the problem behavior with an undesirable event for everybody. Paradoxical interventions are used in strategic family therapy, although they're very complicated. They wind up, the goal of a paradoxical intervention is to get a win-win situation in which it doesn't make any difference what the family does, that there'll be some benefit. And this is much more than just reverse psychology. Some simple paradoxical interventions may be prescribing the symptom and then restraining the family from changing too much because they know how to do this. And at the very least, if they're doing the presenting problem, they're paying attention to it, and that can help them recognize what's happening. Pretending the problem occurs is another interesting way of doing it, because in order to pretend something is occurring when it isn't, it shows a certain amount of ability to be in charge of your actions and behavior. With the Greene family, it's a matter of explaining what their communication is and how it maintains the problem, and interrupting that dysfunctional pattern either with reframing or with doing some type of directive, some type of task to change it. So the worker may describe the Greene's attempts to resolve the problem and ask them to try something different. So we'll try doing this in the role play and see how they respond to this. Certainly one possible reframe is that Alice is trying to show her parents that she's an adult who can make her own life plans. And directives could depend upon the family's agreement with the reframe, but it may be that she may answer any questions from mother by sharing a plan that she has, even if that plan is different from mother's ideas. As I've mentioned in the past, it's helpful for you to jot down your ideas about how you would use strategic family therapy in your workplace and how you would, present this to clients about, how the presenting problem occurs, it maintains the problem, how to interrupt that. How would you assess the family and what interventions would you suggest? It helps also to consider how you would choose a family therapy model. How are the models similar and different? What model fits best for you? And how could you use those models in your work? Other issues that may influence the models you choose and the way that you choose them are ethical issues, competence and how you learn, and do you have enough capability of presenting these with clients, the personal characteristics or family background, as well as the community factors. Think about all of this. And what we'll do is in class, we can have a discussion about this, particularly how it related to the Greene family. And so I'll talk to you about this then.